Welcome to HIMSS 2015. I'm Kathy Berger with Health Data Management, and I'm here with Joe Gregory, Vice President of Marketing with Orbograph, and AJ Johnson, General Manager Nexus with Trizetto Provider Solutions, a Cognizant company. Welcome to you both.
Thank you.
And we're going to be looking at the hot topic of revenue cycle management. So Joe, can you tell us a little bit about Orbograph and its role in the healthcare payment environment?
Basically, Orbograph has been in the revenue cycle arena focusing on the payment side for the last 4 years or so. Basically what we do is we digitize and we convert paper into postable files. And that can apply to a variety of different workflows. It can apply to EOBs, to correspondence documents, patient payments, etc.
How quickly do you see the industry adopting electronic business practices in revenue cycle management, especially around payments?
I think it's going to be really another 3 to 4 years before it gets to the point where everyone's satisfied with the level of automation they're at. And just one other quick point is the fact that the HIMSS Analytics was forecasting that the investment in revenue cycle for the upcoming year is actually backed all the way down to 2008 levels.
So as the volume of e-payments grows, what are the success factors and what are the risks?
So moving forward, it really comes down to resource allocation. And in order to get to this 100% processing approach, you really have to have a transitionary stage, and that way you can take your resources and apply them to some of the other overhead that you have, like ICD-10, meaningful use, etc. And in the meantime, experiences the benefits of more of a straight-through process with your remittance processing.
So in that context, how well are industry players adopting cloud-based healthcare payment solutions, and what are some of the hurdles around further adoption there?
Very interesting topic as it relates to the healthcare industry in general, because what I'm seeing is that accessibility, maintainability, and scalability are the things that are really attractive to a cloud-based environment. The healthcare providers are much more accepting of cloud-based technology. We've actually had a client, South Nassau Communities Hospital, who has implemented our solution, and they found that the system, the maintainability of the system, the way that it integrates with their enterprise, the fact that it's HIPAA compliant, and they don't have to manage that full scale of the implementation, it's very advantageous to them.
So AJ, let's turn to you. Can you talk a little bit about how Trizetto is positioned in the current market?
Our position has grown quite a bit just recently with the purchase of our Cognizant purchasing us. Cognizant is a worldwide organization and focused on IT, resourcing, BPO, and consulting, and bringing that into the Trizetto mix of items. It really helps us all the way around. So we're very well positioned in terms of, especially on the data side.
What are some of the key trends in revenue cycle management space that you're seeing in terms of future capabilities or new capabilities, as well as some of the issues that these systems are addressing?
Today we see this grab for data, and everyone's kind of gotten into data analytics. You see revenue cycle analytics all over the place today. And that's really a long way from where it was, say, 3 or 4 years ago. And now we're kind of looking at not only analyzing what's going on, but also predictive analytics and what's going to happen next. So that's big in the industry, and that, of course, that takes having all your data in your data set. A lot of the systems today don't allow you to aggregate the data in the ways that you need, and that's one of the things that we're able to bring to the table.
What are some of the biggest challenges today around healthcare payments and billing? How are these issues affecting providers and payers?
The new high deductible health plans, for instance, so you'll see in the industry today a lot of patient estimation tools, invoice estimation, so it helps the provider collect a little bit more upfront. Also, of course, we have the accountable care organizations coming into play. So again, that's aggregating data and across multiple systems, payer-provider collaboration, and certainly, again, with tools, and that's one of our reasons with working with Orbograph is to bring all that data together in one place.